tu come è andata qua questi giorni?
Beh, insomma, allora ci siamo sentiti già al telefono, no? Come ho detto, anche ho parlato con la dottoressa Carmignani e con gli altri. La situazione è andata via via migliorando da domenica, vero? È andata migliorando, sì. È andata decisamente migliorando, quindi adesso dopo questo momento di difficoltà che ha passato qua, siamo pronti per andare al CSM. Cosa dici, Sara? Va bene?
Sei d'accordo?
Sei d'accordo che torniamo a Baccola?
Dai, va bene. Avete avuto anche qua dagli operatori di qua tutte le informazioni?
Sì, dopo Paolo aveva già scaricato gli esami che aveva fatto questa mattina, abbiamo visto che stanno migliorando, quindi...
Sì, forse bisognerà controllare questa tiroide anche e poi per il resto, insomma, riprendere il tuo percorso, che peraltro so che era stato molto buono.
Sì.
E quindi, insomma, dai, consideriamolo un piccolo intoppo e niente di più.
Bisogna avvisare a casa? Sanno che torni a Baccola? Non lo sanno?
Avvisi tu o vuoi che avvisiamo noi? Cosa preferisci?
Chiamo mamma.
Chiami tu mamma e gli dici che se avete voglia di vedervi sei a Barcola.
Ok.
Ok? Va bene. Cioè, taglio o pugno?
No, pugno, poi
Pugno?
punti sul...
Tegappunti?
Però tega su tutto.
Tegappunti qua?
Punti qua.
Cosa sta? Cioè, cosa sta? Un colpo?
Calorifero.
Un calorifero ti è venuto contro la mano?
Contro la mano.
Come ha fatto a muoversi?
Non lo so.
Magia?
Magia.
Psicomagia?
Psicomagia.
Dai. Bisogna imparare a gestire la rabbia in modo diverso. Bisogna aiutare a gestire la rabbia, imparare pian pianino. Complicato.
Complicato molto.
Adesso ti capisco. Ma vabbè, dai, ci sarà qualcuno che sarà in grado di aiutarti. A Barcola con chi parli? Hai qualche rapporto con un psicologo?
La psichiatra e la Carmignani.
Con lei discutete anche di questo, immagino.
Sì, anche.
Della rabbia. No. Mi raccomando, non mollare. E poiché sappiamo che i disturbi mentali sono disturbi in cui noi dobbiamo lavorare nel lungo periodo con la persona, cioè non è che superata l'acuzie è finito il problema, cioè superata l'acuzie inizia tutte le altre strategie di intervento e tutti gli aspetti progettuali nel programma della persona.
For the first time, I think, in history, we as a human race can say, we're doing this right. Somebody's doing this right. Italians are doing this right, and especially the Italian people in Trieste are doing this right.
The timing of this trip could not have happened any better, given what is now going on in the U.S.
Heard a lot about Trieste over the years, would not have in any way imagined it to be, I think, what we've actually encountered.
The foundation supported the Équipe to learn in Trieste because of the innovations that the city, particularly amongst our mental health professionals, have led globally, frankly.
The most inspiring thing about this trip is seeing how values-driven the entire system is and how that is reflected in how everyone communicates.
One of the most amazing things is not only are the values explicitly stated, you can see all around us how those values have been used to operationalize everything from physical spaces to the language that is used.
The matter-of-factness with which Italians here in Trieste approach their service towards other people is where I want us to be.
In the homes that we visited, the residential programs, the community comes in, there's a lot of artistic and cultural interactions, and it's not just like trying to reintegrate mentally ill people into the community.
Came to this work saying that I was motivated because I feel like as a society we are in a crisis of a lack of compassion, and I see here the opposite. I see compassion everywhere.
The challenge is a moral one and an emotional one. I walk outside my house and I see multiple people that we're not serving, we're not caring for, we're not even acknowledging, and we're literally allowing people to die on the street in the wealthiest country in the world.
This is a humanitarian crisis in the United States. The increasing numbers of human beings that we're treating in state hospitals who are in horrible physical and mental condition.
We have a fundamentally fatal flaw in our entire design, and it starts with a belief that people can only stabilize and perhaps function and maintain. We are so focused on stabilization that we're not thinking beyond service provision to a person's being.
I think we need a whole new approach to addressing mental illness and addiction that doesn't marginalize people and treat them as separate and unequal from the rest of the community.
In the US, I've been in this system a long time. We don't spend the time on relationships. It's one of the reasons our healthcare system has got its expertise in the emergency room. That's where we spend the lion's share of our Medicaid dollars. That's where we spend the lion's share of all of our healthcare dollars, is in crisis.
Our American system invites providers to do the minimum. Do no harm. Make sure your water temperature is at the right level. Make sure that you have a bed and a nightstand and a dresser in every room, as if that is going to create a quality outcome for someone.
I think we deliver care or offer services that people don't want. We place the burden on the person in need to come to us, and then we just give them what we have available.
We spend more money in the US to incarcerate people than to treat them.
Trieste represents a really incredible model and kind of actualization of an alternative path that we might have taken in the US and could still take in the US. It's completely possible to prevent crisis. It's possible to prevent criminalization. There's so many things that we sort of assume are a consequence of having mental illness in the United States that are actually consequences of our poor system.
So in the US, we have pockets of amazing things happening, but they're very disparate, meaning you have individual people that have committed themselves to doing great practice that is centered on humanity and recovery and human rights, but we're operating in these bubbles.
I'm very excited to go back to the United States and to be able to tell people that it is possible. It is possible to implement something as radical as a loving healthcare social service system, that it can be done.
This is really about leading and driving policy with passion and heart and compassion.
I hope that we're all learning from the Trieste model is that flexibility and adaptability is key.
Let's pay for things that will get results. Let's pay for social inclusion. Let's pay for integrated health care. Let's pay for the family support systems. These are notions that are just common sense, where we're wanting to invest in those things with demonstrated outcomes.
Our human population has had greater challenges than this in our history. We have thought leaders in place. We have people that are strategically located throughout systems. We have 20 individuals from different states this week in Trieste.
This may be the last bipartisan issue in America that most people agree on. The system sucks. Everybody talks about wanting change, but when you have to do it, it's not easy. Most difficult part is making structural change. Now, I'm actually optimistic. What the Trieste trip does with that for me is it helps crystallize what that structure should look like and what services need to be provided and how they need to be provided. And I think that is something that's very doable.